Hey, my name is Josh Korak. I'm a mental health counselor in the Northern Colorado area. In this space, I get the chance to interview professionals in the field, talk about mental illness, self-care, and so much more. With this show, I ask you to join me in doing what one of my favorite philosophers, a Buddhist monk, Thich Nhat Hanh, says. Smile, breathe, and go slowly. This is Care with Korak. Hey everyone, welcome back to Care with Korak. My name is Josh and I'm really glad to have you here listen to this podcast. There's so many podcasts out there and you chose this one, so thank you. Thank you to my regular listeners for being patient while I get the rest of season 2 out here. It's hard, man. It's hard doing all this editing and on top of, working a regular job, being a therapist and keeping up with life and working on a few other projects, which I will hopefully be able to announce soon. But the podcast just kind of fell through the cracks, and so I'm trying to keep up. And man, I've got some good episodes, new year, new episodes. So got a group of 7 or 8 more episodes, I think, to get to you guys. So today we have a really special guest, Mr. Ron D. Anbar. MD, FAAP. Ron is board certified in both pediatric pulmonology and general pediatrics, offering hypnosis and counseling services at Centerpoint Medicine in La Jolla. I think that's how you say it. California. I don't even know where that is. I've been to California so many times. But and also in Syracuse, New York. Dr. Anbar is also a fellow and approved consultant of the American Society of Clinical Hypnosis. Dr. Anbar is a leader in clinical hypnosis, and his 20 years of experience have allowed him to successfully treat over 5,000 children. He also served as a professor of pediatrics and medicine and the director of pediatric pulmonology at SUNY Upstate Medical University in Syracuse, New York for 21 years. Dr. Anbar also worked as a guest editor and advisory editor for the American Journal of Clinical Hypnosis. His experience has offered him the opportunity to direct and co-direct more than 20 clinic workshops on the subject of pediatric hypnosis. Additionally, he has trained more than 1,000 healthcare providers and lectured all over the world. In addition to his teaching and lecturing experiences, Dr. Anbar has been the principal investigator in 10 published case studies of pediatric hypnosis and involved in research trials of children with cystic fibrosis and other pulmonary disorders. He's a published author of more than 50 articles, abstracts, and book chapters on pediatric functional disorders and pediatric hypnosis. Graduating from the University of California, San Diego, with undergraduate degrees in biology and psychology, Dr. Anbar earned his medical degree from the University of Chicago Pritzker School of Medicine. He completed his pediatric residency and pediatric pulmonary fellowship training at the Massachusetts General Hospital and Harvard Medical School in Boston. Dr. Anbar received training in hypnosis from the Society of Developmental and Behavioral Pediatrics and the American Society of Clinical Hypnosis. In this episode, Dr. Anbar and I get to talk about what hypnosis actually is. So many misconceptions out there. Some really amazing and remarkable stories of his use of hypnosis in practice, and then just overall how it can be used for healing and what the heck is hypnosis, right? So for more information about Dr. Anbar, visit the link in my bio. It's centerpointhypnosis.com/Dr.Anbar, and make sure to check out his new book that he just published about some of his experiences in practicing hypnosis. The link for that can also be found in my bio. Follow me at Josh Korak on TikTok, Instagram, YouTube for video clips, podcast previews, and more mental health content. If you are in a mental health crisis, please call 988 or go to your nearest emergency room. If you are from Colorado and are interested in scheduling a session, please reach out at sojourncounselingco.com/Josh or email me at josh@sojourncounselingco.com. All right, well, that about does it. Let's get back into it. Happy 2023, everybody. This is Care with Korak with Dr. Ron Anbar. Hey, Dr. Anbar, how are you doing today?
I'm doing great. Thanks for having me here.
No, thank you for taking your time. I know you're super busy. You're on a book tour right now, so I really appreciate you taking some time to sit with me and with my audience, and we're talking about this idea of hypnosis.
Excellent. It's a wonderful subject that too few people know about.
Yeah, and I'm curious to. I'm sure we're going to talk more about this, but I know it has a long history, so it is interesting that there's not a ton of knowledge around this. So I'm very excited to dig into this. But why don't we just start off, kind of introduce yourself and tell us a little bit about your background and experience and who you are.
Super. Well, I'm a pediatric pulmonologist. I take care of children's lungs. I was classically trained, went to medical school, University of Chicago, did my residency and training at Harvard Medical School. And I ran into hypnosis about 25 years ago. I was treating young men with asthma and terrible allergy to milk products. Twice he almost died from eating a milk product.
Wow.
And he came in one day and he said, lately when I've been smelling cheeseburgers, I've been developing asthma attacks. I thought it was rather strange sounding symptom, but I thought maybe like a milk molecule is wafting through the air and affecting his breathing, which it cannot do, by the way. I found.
Really?
Yeah.
Interesting.
And I said to him, well, can you imagine eating a cheeseburger? And he closed his eyes, and within seconds he was having a really hard time breathing. And the thought that crossed my mind is, oh no, he's going to have a significant asthma attack here. I said, stop it. And he did. And I said, you're kidding me. No, I couldn't breathe. He said, that was my asthma. I said, whoa, you can imagine yourself into an illness? And of course, then the corollary is, can you imagine yourself out of an illness? And later I found out this was hypnosis, and that was my rather dramatic introduction to the field. So I asked myself, well, how can I help this young man? I said, let me send him to a hypnotherapist who could teach him hypnosis, and then he could come and teach me what he learned. I was interested in this because I've always liked psychology. In college, one of my majors was psychology. And my patient, whose name was Paul, he said, I don't want to go see a psychologist. I'm not crazy. I want to work with you. I said, that's really nice, but I don't know anything about this. And he said, I don't care. Teenager.
Right.
So I went to my friend, the psychiatrist, Dr. David Keith at Upstate Medical University in Syracuse, where I was working, and I asked, can I learn about hypnosis and teach him, and can you back me up? And he said he would. And that's how I got started. I went and started reading about hypnosis, and it has a very long history, as you mentioned. We can get into that later if you like. And I started practicing with Paul, and for a year he was my only patient. We just did a lot of different things together. I found out later there are societies for hypnosis, such as the American Society of Clinical Hypnosis, where I received training. But I had the freedom of not knowing what I wasn't supposed to do in my first year of doing it. And that was good because I got to innovate. And several of the things I talk about and teach about now are things I developed in the first year of doing hypnosis.
Wow, yeah, so there's almost this freedom to explore, maybe try new things that maybe you wouldn't have even thought of if you were like fully trained, fully on this path initially to be a hypnotherapist.
It was similar to how I was trained to be a physician. Back in the 80s when I was in my training as a pediatrician, I was working at Massachusetts General Hospital in Boston, and I remember the day after medical school, I'm there, and I'm in the emergency room. I'm the only doctor there. There's a third-year doctor training upstairs in the hospital, and all of the attending doctors are not there. This is very different than today. And so you have to like fly by the seat of your pants, and you learn very quickly. It might not be the best of patient care, but you learn very quickly. And throughout my medical career, if something new came along, I just learned. That's
right. Yeah, so you had this patient come and saying, hey, I need hypnosis, because it almost sounded like some sort of panic attack or like something anxiety based. Was that kind of what you found out?
Well, in retrospect, it was a panic attack. It might even be a conversion disorder.
Oh, interesting. Yeah. Can you explain for my audience who may not know, what is a conversion disorder?
A conversion disorder is one in which a patient has a psychological problem and can't resolve it, and then it's manifested or it's solved through physical symptoms. So, for example, I saw a young lady once who developed vocal cord dysfunction. Vocal cord dysfunction is when your vocal cords, when you're taking a breath in, your vocal cords are supposed to open, but instead they close, so it's hard to breathe. And this is actually a fairly common diagnosis. As a pulmonologist, I would see patients with this like twice a week. Frequently, they'd be triggered by stress related to exercise or related to competition. So teenage girls especially are competing really hard, and they try so hard, they close their vocal cords when they're trying to breathe, and that, of course, disrupts the exercise. This particular girl, she came at 12, and her vocal cords were closing when they were supposed to open, but it wasn't with exercise. It was all the time, including in her sleep. So at first, the doctors thought she had asthma because she couldn't breathe. But that's what doctors usually think, it's asthma. But it wasn't. It was the vocal cords. I taught her hypnosis to relax herself. And in most patients with vocal cord dysfunction, if you relax, the symptom is solved. It's just that simple. But it didn't get better. I told her to go practice for a week. She came back, and she still wasn't better. I did an MRI scan to make sure she didn't have a brain tumor, and she did not. And I said, well, something is preventing you from getting better. Let's talk to your subconscious. And this is something you could do with hypnosis, is talk to the inner self. And I hope we'll talk more about that, because for some reason, most psychologists don't talk to the subconscious. And to me, why don't you just ask the patient to explain the problem? So her subconscious said that she saw her stepfather selling drugs, and she did not want the girl to tell her mother what she saw, because that would create problems in the marriage. So she made sure she couldn't talk.
Wow.
This is an example of a conversion disorder. The girl didn't know what to do about it, but her body decided, well, just close her vocal cords so she can't talk, and that'll solve the problem.
That's amazing in one aspect, super sad in another.
Well, once you know the reason for the conversion, you can fix it. So I talked to her about it and said, can't you trust yourself? And the subconscious said, probably I could. But if she starts talking about it, I'll make sure she can't talk again. I said, okay. And I asked, is that safe enough for you? And the subconscious said, yes. And right there and then, in the middle of hypnosis, the symptom resolved.
Wow. I mean, how cool is it that, and again, I know we're going to talk more into this, but how cool is it that you get that very direct, this is fixed now? That must be just something else. I mean, very cool. It's
and
interesting.
You can't do that with medications, typically.
Right. Well, no, medication. It's especially when it comes to things like mental health. It typically can take up to weeks to even see any sort of resolution in symptoms. Right. So that is a very special experience, I'm sure, especially as a provider client relationship. Right.
Right. It became the favorite thing of what I did as a physician, is being able to help people help themselves. I should interject early on here, because some of your listeners may not have heard of much about hypnosis in the clinical realm. Hypnosis is not what most people think, right? So it's not
That was
magic.
my next question. What is hypnosis, right? When I think of hypnosis, I think of I'm a big superhero fan, right? So I think of the Mad Hatter from Batman, right? Who's got his he's got his watch, he's got his mind control hats, and he's just always hypnotizing people. But that's not hypnosis, right? So what is hypnosis?
Right. So it's not mind control. It's not somebody controlling your mind. It is a way of controlling your own mind better. And all hypnosis is self-hypnosis. And it's not unusual. So if you daydream, that's hypnosis. If you're driving down the road and gone 3 miles and said, how did I get here? That's hypnosis.
Really?
Yeah, that's called highway hypnosis.
Right. Well, I have heard that before, and the way that in my training I've heard that described is those are dissociative states. Is there kind of a similarity between what we call dissociation, what we call hypnosis?
Yes, hypnosis is a dissociative state.
Interesting.
But it's not a pathologic dissociative state. It's a way of separating the conscious from the subconscious. The way I explain it to my patients, I tell them, I'm going to teach you how to park your conscious self, and so your subconscious can better express itself. And that's not just when I directly interact with the subconscious. Really, most hypnotic phenomenon begin in the subconscious level. So, for example, let's say you have a headache. And I teach you one way of getting rid of a headache is imagining your headache is a particular color. And the patient will pick red. Now, what will your head feel like, or what color would it have once you feel better? Blue, okay? In your mind's eye, imagine your head as red and let it change to blue. And notice how when you make the change, you start feeling better. That's a simple hypnotic suggestion.
Interesting.
Well, that change is occurring on a subconscious level. Consciously, you have no idea what's going on, but subconsciously something is happening. So most hypnotic phenomena are occurring on the subconscious level.
Mm-hmm. The subconscious being not what we're fully aware of, not what we're completely unaware of, but somewhere in the middle.
Well, sometimes you can be completely unaware. It's below conscious awareness. Right?
So sometimes it's unconscious.
Well, so it depends your term. So some people call unconscious things that you can never become aware of, like the autonomic nervous system functions. So that some people say subconscious, preconscious. I lump it all as subconscious. Anything below conscious awareness is called subconscious.
Gotcha.
Clinically, that's all that's necessary.
Well, it's good for us to define. Yeah, that's great.
Yeah. So we talked about earlier why people aren't using more hypnosis, and I think the fact that people don't understand it or are afraid of it, an evildoer will make you do things. Or, Hollywood has contributed to our belief of what hypnosis is.
Right.
Our misconceptions about hypnosis. So I think that's one of the reasons it's not used much. Another reason it's not used much is that historically people have made some fantastical claims about hypnosis. I mean, things that, like you could self-diagnose whatever disease you have, or that it could give you psychic powers, and that's not what hypnosis is. So when people started making fantastic claims, people thought it was not real. And then a third reason I don't think hypnosis is used much is it's not perceived as a moneymaker. There's no pharmaceutical company pushing, hey, prescribe hypnosis. So in the medical realm and in the mental health realm, people, it's not the forefront of what they know.
Right. Well, I'm curious. Oh, sorry. I was just curious, like, along with that, does insurance can obviously be a big hurdle for clients seeking treatment. Is hypnosis even something that insurance considers?
Some insurances reimburse for hypnosis therapy. However, I actually collect insurance for my hypnosis work, but I don't bill for hypnosis. I bill for counseling time. It's a form of counseling. And as a medical physician, I can do that. Hypnosis is one tool in counseling. Like I won't bill for, cognitive behavioral therapy. Or,
true. It's an intervention. It's a form of therapy.
Right.
You're not billing specifically for hypnosis. You're billing for the counseling. You're billing for that treatment. Yeah.
Right. I'm not billing for positive psychology or collective behavioral therapy. I bill for counseling.
Yeah. Okay. Yeah. That makes a lot more sense. Yeah. Gotcha. Anyway, sorry, I didn't mean to divert you, but so you're talking about just the three reasons that, or the few reasons that most people don't use hypnosis right now.
Right. So another reason I think people don't use it is it's not being taught in the medical schools or in the schools of psychology, presumably because the teachers have never used it. So it's interesting. I guess an analogy would be in dentistry. I don't know. Have you ever been exposed to laser dentistry? Do you know what that is?
No. What is that?
So laser dentistry is the dentist uses a laser in your mouth, both to numb your tooth because the laser will numb the nerve, and to do actual dental work. And so if you have a cavity, you can, rather than using a pick, you can use the laser. And you can do this kind of dental work without any anesthesia and any discomfort. It's like you sit there and the tink in your mouth, you don't feel anything, and you're fine. It's amazing.
Well, it sounds amazing.
Yeah. When I first had experienced this about 6-7 years ago, I said, wow, this is great. This is how dentistry should be. People are so afraid of shots and pain, and this is like comfortable. So I asked the dentist, how long has this been around? Oh, 25 years. 25 years? How come not people aren't using it? Well, he said, first of all, if you're going to use it, you have to learn a new kind of dentistry because you're not touching the tooth the same way. And you have to spend $80,000 buying a machine to deliver the laser. And most dentists don't want to go through the trouble. I said, okay, I understand that. So why don't they teach this in dental school so all the new dentists will know it? Oh, the dental schools are being taught by old dentists. They don't know about lasers. And I thought to myself, this is similar to what's happening in hypnosis. And we need to surmount it. I mean, dentistry, if it can be painless, let's do it. Hypnosis that can help so many people, let's do it. Why are we waiting? But the truth is that progress and change in healthcare, both medical and mental, is very slow. And this is one reason I wrote a book recently. It's called Changing Children's Lives with Hypnosis, A Journey to the Center. And I wrote it directed at the public. And I explained how I've used it over the last 25 years in my practice. And I'm hoping to help capture the public's imagination, and maybe the public will push the physicians to get the therapy for their loved ones.
Yeah. What would that even look like? I mean, how do we start to bring, well, I have some ideas, but how do we start to bring more awareness to the subject of hypnosis?
Well, I think this book tour that I'm on is one way of doing it. I speak to podcasters, I've spoken to radio stations, TV stations, I'm blogging now for Psychology Today. It's getting the word out, I think.
Which is how I found you.
There you go. So it's working at a low level. I guess I'm hoping to get a national TV appearance. I think it's interesting, and I've been doing this for several months now, this book tour, and most of the impact, the two things that impacted most in terms of people responded is one 2-minute segment on a local TV station about an athlete who used hypnosis, one of my patients, to become the star athlete on his high school football team, high school basketball team, excuse me. And so that garnered a lot of interest. And then the Psychology Today blog has gotten some interest. And then Amazon ads have made a difference. But everything else, not much of a difference so far. I'm planting trees, and maybe over time more people become aware.
Yeah. Well, I mean, that's just how anything goes, right? So getting a better understanding of what hypnosis is, what do you actually use hypnosis to treat for? What can hypnosis help with?
Well, that's a great question. And let's take a step back and understand that anybody with chronic symptoms can benefit from hypnosis. Anyone with chronic symptoms. So we're talking about more than half the country. Let's start with that. And let me explain why. If you have a chronic symptom, be it physical or psychological, it's going to, and you have a head on your shoulders, you're going to react to those symptoms. Maybe you'll be anxious about them. Maybe you'll be depressed by them. Maybe you won't like the fact that they've changed your life. Okay? Once your psychology gets involved, it's going to impact on how the symptoms manifest themselves. So, for example, if you have inflammatory bowel disease, so inflammatory bowel disease is physical problems in your bowels, Crohn's disease, ulcerative colitis, and you have a bad boss at work. When your boss bothers you, you're going to have worse stomach aches. Or you have this and you're worried that you have to always have a bathroom nearby. And if there's no bathroom, you get anxious, and then your stomach ache gets worse. This is an example of how a real physical problem gets worsened by your psychology. And conversely, if you learn how to calm yourself, like my cheeseburger kid, then the symptoms get better. So that's one set of patients. The other set of patients are people whose psychology caused them to develop symptoms, and that's a large number of patients. The boss at work can cause you to develop headaches. The bully at school might cause you to develop stomach aches. I mean, we're familiar with that. You're stressed by your spouse, you get chest pain. If you go to the emergency room, more than half of the people who come to the emergency room have a psychological issue that triggered their symptoms. So you teach those patients to control their emotions, and then their symptoms sometimes go away completely. That's the main message. So people with headaches, with stomach aches, with shortness of breath, then there's bedwetting and anxiety and depression and hair pulling, smoking cessation, controlling your obesity. All those things can benefit from hypnosis.
Yeah, that's amazing. So what's really standing out to me is that it really focuses on this idea of chronic symptoms, and that more than half of people have chronic symptoms of something. like anything.
Correct. Well, people with acute symptoms that are happening right there and then, can also benefit. My late friend, Dr. Dabney Ewan, was a burn surgeon, and he would routinely use hypnosis for people with acute burns. In fact, he's told me that if somebody who was just burned uses hypnosis right away, such as telling themselves, I want to feel cool and comfortable, that would slow down the progression of the burn. Sometimes would make what's going to be a third-degree burn into a second-degree burn, or what's going to be a second-degree burn into first-degree. So he was and I believe him. I mean, that was his specialty. So people with acute problems can also benefit from hypnosis. The problem is getting someone there to teach them during the crisis. Mm-hmm. I remember one time I was in an airplane, and I was writing a blog about physician's role, and up overhead is there a doctor on board? And
Oh, no.
You never like answering that, because you never know what you're going to get, right?
Yeah.
And another, is there a doctor on board? I said, okay, I better fulfill my role. So I get up, and a 55-year-old gentleman is having chest pain, and I'm saying, I'm a pediatrician, I don't know how to take care of this. So they get you to talk to ground control there, the EMTs. They said, start an IV. Okay, so I fumble around and start an IV. They have that on the plane. And I give him sugar. I said, okay, I do that. Now what? We'll do an emergency landing soon. I said, okay. And I'm thinking there, what am I doing? How can I even help this guy? But then I realized that my presence as a doctor, even though it wasn't my field, was comforting. And I put my hand on his hand, and I said, you'll be okay, sir. And I just talked to him calmly, which wasn't formal hypnosis, but it's hypnotic. And he survived until we landed, and EMTs took him off the plane. And so that was, again, in an acute setting, hypnosis can help so much.
Wow. Yeah, so it can even help in those crisis kind of settings.
Yep.
Again, what's standing out to me, so hypnosis can just look a lot of different ways, it's sounding like.
Right. So again, the basic idea is using your imagination to help yourself in some way, but there's many, many ways of doing it. And, you can do a meditative kind of thing, like imagine a sailboat on your sternum, on your breastbone, and watching it go up when you inhale and down when you exhale, and just focus on that, and that would cause you to calm down, actually for a physical reason, because you're releasing chemicals that are calming when you breathe in that fashion. I gave you the color change example. That's using a metaphor to talking to the subconscious and saying, what's the problem here? That's more direct approaches. There's so many different ways of using it.
Yeah. But it's sounding like maybe the role of the imagination plays a really key factor in the use of hypnosis.
Yes. The other key factor is that the person using it, that the patient, wants to use it, because, again, it's all hypnosis, self-hypnosis. So one of the things I learned early on is how important that was. After doing this hypnosis for 2 or 3 years, I kept detailed notes, and I looked back at all my patients over the time period, and I noticed that 85% of them improved. Not some of them completely, but others just improved. But 15% did not improve. And I noticed that of the 15% didn't improve, what was common is these are ones who were ambivalent. They weren't quite sure they wanted to do hypnosis. And when I first was doing hypnosis, I thought the power was in the words that, do what I say, it'll happen. But no, the power is in the patient. So if the patient's ambivalent, it doesn't work. So since then, I've learned not to do hypnosis in somebody who's not sure. And my success rate in terms of improvement is probably 99%. If you're going to do hypnosis, most everyone improves, because most everyone has ability to control their body with their mind. It's just a matter of learning how to do so.
Right. What are some of the ways that you kind of facilitate this then? Like, what does this actually look like in a general practice kind of setting? So after I explain to a patient and their family, if I'm working with a child, of how they could benefit and getting their buy-in, I will start with a simple exercise, first showing the power of words. And how it works is I'll have the child stand up, extend their arm to their side, and tell them, don't let me push your arm down. Let's see how strong you are. And then we'll repeat the exercise. But before I push on their arm, I ask them to tell themselves, I'm weak, I'm weak, I'm weak.
And when that happens, their arm goes down easily when I press down.
Really?
Now, you can try this at home, people. Do this at home.
Yeah.
Then I'll say, now say I'm strong 3 times, and repeat the exercise, and that arm is strong. And I say, how does that work? And they figure out, well, what I say is what happens. I say, that's right. What do you think will happen if you say I'm not weak? And I'll have the child do that, say I'm not weak 3 times, and guess what? They get weak. They become weak. And why
Even
is that?
though they're saying I'm not weak.
Correct. And why do you think that is? Because the mind is focusing on the word weak.
Yeah.
So then we have a discussion about you want to say things in a positive way because what you say is what happens. And so we'll practice. Like if you have a stomach ache, how do you say that in a positive way? That'll usually puzzle the child. And I suggest the answer starts with I wish or I want. So they might say, I wish my stomach didn't hurt. I said, no, that's not positive. That's what you don't want. What do you want? I wish my stomach felt better. Good. Now let's say you're scared about something. How do you describe that you're scared in a positive way? I wish I felt braver. That's right. And so the first homework assignment is learn to say things positively. And this is actually very powerful. It's the weakest tool I teach, but it's very powerful. For some
Right.
patients.
I mean, to some degree, it's just self-affirmations, right? It's just trying to learn how to be kinder to yourself, to say more positive things, and maybe with more of an intention on what's actually going on that's causing you problems, right? But it's interesting.
Right, but one difference between affirmation and what I'm proposing is an affirmation is saying things like I'm smart, I'm handsome, whatever, and the child may not believe that. And the idea with affirmations is that if you keep saying, you might believe it. My idea is you want to 100% believe it. So rather than saying I'm smart, say I want to be smart.
I want to be, or I wish to be.
I want to be healthy. So that's always true. So if you want it to be completely believable. So that's a first lesson. And I've had patients come back after a couple of weeks and they're remarkably better. Sometimes their symptoms resolve just with positive talk. The next lesson, the second lesson, is typically how to do what's called basic hypnosis. So, now again, there are many ways of doing it, but what I do is I teach them how to relax with hypnosis as long as they like relaxing. Some kids don't.
Right.
Their parents tell them, relax already.
And they're like, yeah, well, that's going to make me relax.
Then we're going to do a happiness exercise. If they don't want to relax, do you want to be happy? So usually it's the yes. If they say no to that, they're not really into working with you. So I will teach them to relax with hypnosis by having them imagine a safe, relaxing place. Ask them to imagine what they might see, hear, smell, feel, and taste there, so using all their senses. And the reason for that is that it activates the whole brain. When you imagine a sense, the same part of the brain that actually senses those things activates. You get increased blood flow there.
Oh, wow.
And I ask the kids, why do you think we do this? And they say, well, it becomes more real in their imagination. I say, that's right. Then I'll walk them through progressive relaxation. I'll ask them what they're doing, maybe laying on the beach, maybe playing in the water, maybe hiking. Whatever they're doing is fine. And as they do that, I'm going to talk to them about relaxing from your head all the way down to your toes. Once we do that, this is an important part, I tell them they're going to pick their own relaxation sign. The lingo in hypnosis is anchoring gesture, but that's not what the patient say relaxation sign, and its purpose is to trigger your relaxation response. So they might cross their fingers, make a fist, make a peace sign, their choice, and they tell themselves in hypnosis, whenever I make my sign, it can immediately relax, even when I'm not doing hypnosis. So that's a post-hypnotic suggestion that they're making for themselves. It's a suggestion that will take place once they leave hypnosis. And then I tell them they can stay in their hypnosis relaxed state as long as they want, a minute, an hour, a year. Time has no meaning. It's like a dream they're in charge of. And when they're ready to come back, I ask them to raise their hand. When they raise their hand, I'll tell them, well, you should congratulate yourself for having an excellent imagination. Remind yourself to practice this every day for at least 2 weeks. This is a mind-body skill. The more you practice, the better you become at it. Remind yourself whenever you want to calm yourself without doing hypnosis to make your relaxation sign. and then tell yourself good things. This is when, again, you can use the affirmations or positive talk. When you're in a hypnotic state, you're more receptive to suggestions. And the reason for that is that your conscious mind is sort of out of the loop, so it's not saying, no, I can't do that, just accepts the suggestion, and then come back when you're ready. So that's generally how I teach hypnosis. And by virtue of just learning how to relax, 2/3 of my patients with medical issues improve a great deal. And so it's really a powerful tool that takes a whole 10 minutes to teach and can change a lifetime. Example, 16-year-old boy came to see me with irritable bowel syndrome. He's had stomach aches for 13 years. He's been on many medical tests, many medications, didn't really help much. His life is derailed. He can't get to school before 10 in the morning because of his stomach aches. He can't go to after-school activities because of his stomach problems. Life's derailed. I teach him what I just told you. I also taught him to interact with the subconscious. That would be the third lesson.
Okay.
And within 3 weeks, his symptoms are virtually gone.
Wow.
And this was 20 years ago. I just contacted him recently. I asked permission to use his name in my book. So he's doing fine 20 years later.
And he's still doing good. No symptoms.
He has occasional symptoms, but he takes care of them. He just relaxes and he's fine.
Wow.
You know, this is why people need to understand this. There are people out there suffering and they don't even realize there's a solution, and their doctors don't realize it.
Yeah, I mean, this is just, I'm trying to process it all. I mean, this just sounds super healing, right? For those who are really just struggling, like you said, who don't even think there could be a solution.
And the best thing about it, or one of the best things about it, is that people do it for themselves. Can you imagine you're working with a teenager who now understands he can help himself, how empowering that is, how much confidence that builds?
I mean, they must be feeling on top of the world now, especially as somebody younger.
Right.
That's so special. Yeah. So getting it more into some of the groundwork you do with basic hypnosis, right? At what point do you start to do more work with a client or a patient who isn't benefiting from what you're calling this basic hypnosis? So
in a third visit, so I told you about the first visit with the words, the second visit teaching the basic hypnosis, and most will start improving some. If they haven't, there's a problem already. Either you're dealing with a conversion disorder that you have to figure out the underlying issue, or you don't have a good relationship with the client. But most patients start improving. But if they're not resolved, then the next step would sometimes is starting to use different metaphors, different ways of talking to the subconscious, or you can teach the patient to interact directly with their subconscious. Typically, I do that, and there are different ways of doing that. The simplest is through what's called ideomotor signaling. Ideomotor means muscle movements without conscious control. So, like the muscles have their own ideas, but it's really under subconscious control. And you can teach the subconscious to interact with you as a therapist or the patient themselves by moving fingers. One finger can rise to indicate yes, one finger can rise to indicate no, and one can be I don't want to say. And then you can ask questions, yes/no questions, to help figure out what's going on. And you might ask, for example, do you know what's going on with the patient? And if subconscious says yes, you can say, could you please tell the patient what's going on? And then the patient will say, oh, this is what's happening. It could be as simple as that.
Wow. So have you, talking with clients and patients after they go through these experiences, what are they saying in terms of is it this what we think of as a hypnotic state where they're just completely unaware of what's going on, or what's the experience like for the patient during that?
Well, it varies. The basic hypnosis, going to a relaxing place, they will typically remember it, and they'll say, I feel much more relaxed. And some people will say, I've never felt so relaxed in my life. And I say, wow, that's after one session. Imagine what happens with practice.
Right.
The subconscious stuff, depending how you do, they sometimes don't remember. So if for example, you set up a system where the subconscious talks to you verbally or types for you, subconscious can type. Typically, patients do not remember that. Sometimes they want to know what happened. But when I first started doing this, I was shocked that the majority of patients do not want to know what the interaction was like.
Really?
Which is really interesting. It's counterintuitive. You'd think if you talked for an hour and didn't remember it, you'd want to know what was said. And I think the reason they don't want to know is that if you've dealt with psychologically difficult material, they're not ready to face yet, they don't want to know.
It's almost like an
totally
avoidance thing.
Yeah, they're disinterested. No, not interested. So in many of those patients, my role over the coming weeks and months is to prepare their conscious to become being ready to understand what's going on. But sometimes that's not necessary. So sometimes patients can get better without knowing what the problem was. And a boy who taught me that was an 11-year-old boy who came to me with shortness of breath. And his subconscious said the reason he developed shortness of breath, this was in typing, was because his father was pushing him too hard in sports. But I didn't want to tell the father this because he was afraid his father would leave him. The parents were never married. The father had heart disease, the mother had cancer. And they lived across the street from one another, and this was the kid's fear. When he came out of hypnosis, had no recollection of what he had said and didn't want to know, which I respected. So I kept seeing him for a number of months, and every time he came, I wanted to help him sort of figure out this was the problem, and maybe talk to his dad. But he wouldn't. At one point, I offered to show him what he typed. He said, okay. I showed it to him, and he got really upset. I didn't type this, he said. Okay. Another time, his father came with him. And I said, is it okay if I can talk to you about your father? He said, yes. I said, is there a reason a boy might be mad at his father? He starts to cry. I said, oh, getting somewhere. I said, you're crying. He said, yes. I said, how does that make you feel? It makes me feel better. Why? The tears on my cheeks are cooling me off. Talk about refusal to have insight. After a few months, he said, okay, we're done. He was no longer short of breath. I'm going to come back. I said, great. How did I help you? He said, we talked. And I'm thinking, we never talked about the real issue. I said, can I show you what you typed? He said, yes. So I showed it to him again. Yeah, I typed this. And he was laughing at his typos. And I said, what about the part that your father was pushing you too hard? He said, oh, he stopped doing that. Maybe I dropped enough hints. Now, that boy taught me that you don't need to know what's going on or in your subconscious, and things can be resolved without knowing.
Right. Wow. I mean, this is just super, super interesting. I don't even know. There's just so many things we could talk about with some of this. I'm curious, looking at this from what maybe, again, a general population knows about hypnosis, how does this compare this, hypnotic state where we're not, your patients aren't remembering what's going on? How does that compare to when we think of, again, these people out there who are doing hypnosis to people out on the streets for fun, for entertainment? Like, is that even comparable, or what's happening in those situations?
Well, in the situations where, like, the magicians do it and people do it for entertainment, I mean, the hypnosis is taking place, and the charisma or the authority of the hypnotist, and we'll call them hypnotists in quotes, because the only real hypnotists are the patients themselves. But the authority of the hypnotist makes the people believe that they have some power, and then they act accordingly. If you believe you're going to be hypnotized, you can be hypnotized. There's a famous study of they were testing hypnosis in an experimental setting, and there was a tape where patients listened to get into hypnotic state. And they did the experiment, and one day several patients did the experiment and got results, and the researcher figured out that the tape that they were listening to that was supposed to hypnotize them was not the hypnosis tape, it was music tape. But they became hypnotized anyway. Because they expected to be hypnotized. So I think what you get in hypnosis of entertainment is people are hypnotized. They're doing it to themselves, but don't realize it because they expect it. And then the hypnotic suggestions are powerful. If you take them in, you can cluck like a chicken if you want. You can faint. You can fall asleep, appear to fall asleep. The sleep you see in the stage hypnosis is not real sleep, and you know it's not real sleep because when they say wake up, they wake up. But
to some degree, there's some authenticity in what we're seeing.
There is, but the underlying message is somebody can control your mind, or somebody can cause you to do phenomenal things. And the truth is, you can control your mind. You can do phenomenal things. You can heal yourself. You can better yourself. You can become more creative. You can become a better athlete. It's all in your control, and that's what we need to teach.
Right. Well, so you just recently wrote this book. You're on a book tour right now. Could you tell me just a little bit more about what all your book entails? Obviously, I'm sure it's talking about what we've already talked about, but tell me a little bit more about it.
Yeah, I think we cover my book pretty well. So the book starts off explaining how I got into hypnosis. And then we talk about how the words have power. So one of the stories in the book is about a 6-year-old boy who had seizures from birth. He had a brain bleed when he was young, just after birth, and that caused brain damage, and he had like seizures 3 times a month.
Oh, wow.
And I was seeing him for his asthma and his stomach aches, but I wondered if hypnosis could help seizures, and I asked his mother, would it be okay if I taught him some hypnosis? Now, 6-year-old hypnosis is very different from what I described earlier, which is more appropriate for elementary school children and adolescents and adults. 6-year-old hypnosis goes like this. Who's your favorite character? SpongeBob SquarePants. I hate SpongeBob, but he's helped many of my patients.
There's a club.
What is SpongeBob made of? Sponge. And what makes him a sponge? He has holes in him. Okay. So every night before you go to sleep, put SpongeBob on your head, and if a storm comes, let it go through the holes instead of sticking around. That was it. That was the hypnotic suggestion. It took a whole minute or two. So every night, the boy would, first he put on his SpongeBob toy, but I was pretty sure it was an imaginary toy, and he suddenly would wrap it around 2 or 3 times his head and tell himself, if a storm comes, let it through the holes. And he hasn't had a seizure since. It's been 8 years.
Wow.
I contacted him for the book as well to get his permission to put the story in.
Sure.
So now his EEG, his brain waves, are still abnormal, but he doesn't have any overt seizures anymore. Power of words. That's the second section of my book. The third section is about the subconscious and different ways to interact with it. And, the subconscious is a source of creativity. I've had poets, I've had musicians, I've had artists who gain all this information from their subconscious. It's really interesting. I think that most creative endeavors happen at the subconscious level first. J.K. Rowling tells a story that she was riding a train, and one day the whole Harry Potter saga came fully formed into her mind.
Right.
Where did it come from? Her subconscious. And then the last section of the book is about the power of spirit. We haven't talked about that yet. I find that teaching patients a spiritual perspective is healing. And I think that's, again, somewhere we are very remiss in Western medicine and in Western mental health.
Right.
A lot of clinicians say, well, that's not my realm, go talk to your priest or something. But I think that's wrong. I think having a spiritual perspective is healing because it puts the stresses you're dealing with into some perspective. Like, will this matter a year from now? Is a good kind of spiritual question. And spiritual doesn't mean religious. If you have a patient who is religious, use that.
Right.
Let them pray to God to be healed. Why not? I mean, that's their belief system. But what I find is when people learn about their subconscious and realize the subconscious is the seat of a lot of information and wisdom that they may not have had before, that's a spiritual encounter. And by keeping that in mind, they can put things in perspective. I would interview the subconscious and say, what do you think about the patient's problem? And the subconscious may say, well, it's not really a problem. It's going to resolve it. It has the wherewithal to say that, and that can be calming. Another thing you could do with the subconscious is actually invite them to have spiritual experiences. So, for example, a young child who's lost a loved one can use hypnosis to imagine interacting with that loved one, and that's always a healing experience. And following such experiences, the youngster will often say, oh, that was real. And then they change. The grief may lift dramatically, or they may have a much better calmness in dealing with their loss. And that's a spiritual therapy that hypnosis can facilitate.
Right. Wow, what a cool realm where it really does approach it from a holistic standpoint, right? We're not just pulling from the psychological, we're not just pulling from the biological, it's everything. It's psychological, it's biological, it's spiritual, it's socially, it's all these different components that you're pulling in.
And we should say they're all one, right? We're not physical, and then there's a mental part to us, and then there's a spiritual part to us. They're all connected, all part of the same thing.
Right.
So I think in treating clients and patients, you really want to treat the whole person. I think one of the problems with having diagnoses is that healthcare providers, mental health providers, treat the diagnosis. That's not treating the patient. And the diagnosis can be really harmful, especially if the patient or therapist believes it. Because, for example, if you make a diagnosis and it's incomplete or incorrect, and you as a therapist keep treating the diagnosis, you're missing the boat. The patient's not going to get better. Or the patient believes the diagnosis and starts acting that part. Patients will say, well, I have autism, so I can't get better, or I have bipolar disease, so that just explains my behavior. I have no reason, I have no responsibility for my behavior. Well, that's not true.
Right.
You've got your set of abilities and disabilities, and you need to work with them and do your best with them. So I find diagnosis limiting, and I tell the patient, let's just talk about your challenges and how to overcome them.
100%. How do you see that presenting as a challenge right now with just this is something that's been coming up more for me as a provider with my clients, especially working a lot with kids as well. Things like TikTok and Instagram and all these social media sites, that there's been an uprise in the amount of videos going out of different people saying, this is what ADHD is, this is what DID is, this is what autism looks like. And then all of a sudden these clients are like, oh, well, I have autism, right? I have dissociative identity disorder, right? All these kind of pretty severe or sometimes severe disabilities or illnesses even. And so I'm curious how maybe you've been confronted by this in your practice.
So, since the advent of internet, this has been an issue. Before TikTok and all that stuff, patients will come in, well, I read on the internet that this is how you should treat my condition, and I want to say, well, then have the internet treat your condition. Don't come and ask me what I want, what I think.
Fair enough, yeah.
But, there's a lot of misinformation, obviously, on the internet. And one of the things that I think has been really helpful is for me in conceptualizing and to teaching my clients is the idea that there is a gradation between quote-unquote normal and disorder. So if you have obsessive-compulsive tendencies, that does not mean you have obsessive-compulsive disorder. The disorder means it's affecting your life in a bad way. So, if you have anxiety, that can be really helpful. It might make you study more or be more careful when you drive. It's a disorder if you can't drive because you're too nervous. Or if you can't study because you're too nervous. So making that distinction has helped a lot of the children I work with understand, no, they don't have a disorder. They have some tendencies, and that's fine. The tendency can be very helpful. Being compulsive would be very helpful if you're an accountant and double-check your figures. So that's been really helpful for a lot of my clients. The other thing I talk to them about is, especially after the examples of how they can talk themselves into being weak or strong, and they realize how suggestible they are, I talk to them, be careful. You just take it in, it becomes your reality. Is that what you want? Do you want this reality? So no, then be careful what you expose yourself to, and don't accept everything you hear.
Right. Yeah, well said. I'm interested, this is a little bit of a side trail, but I'm interested if we could speak more. When I've been doing research, so typically I do a lot of work with trauma. So I'm a certified trauma professional, whatever that means, and do cognitive processing therapy for trauma. And so I've been kind of looking at like where do I want to go next in terms of treating trauma. And so I've heard things like EMDR, neurofeedback, things like that. And one thing I've heard and has been recommended is hypnosis for the treatment of trauma, specifically when dealing with things like dissociative identity disorder, which, as we know, can very much result from extreme trauma, right? Can you speak to that at all? What does hypnosis look like in the treatment of trauma or dissociative disorders?
So I think you want to be careful in that setting because hypnosis can potentially worsen dissociation because it is a dissociative experience. So you want to know what you're doing is the first thing. So take training in hypnosis. But I think having a dissociative identity disorder is not a contraindication doing hypnosis, just to have to be more careful. One of the things that I find extremely helpful is to ask the patient's subconscious, is it okay to go down this line of therapy? So the subconscious sort of guides you. And I think when people get in trouble with hypnosis sometimes is when they force the idea on the patient. I think if you are gentle and ask, is this a good idea? You get actually guidance. The patients will guide you through it. So, for example, if I was dealing, and I don't have much expertise, I've dealt with some patients with, I guess, could have been called DID, but some people say DID everywhere. But I've dealt patients who have different voices, and I don't label it because I think that's a bad
Trying to
thing.
avoid the diagnosis in general.
And again, I think that being able to dissociate is what is normal in hypnosis, right? So it's not a DID. It would be, if you dissociate and couldn't reassociate, that would be a disorder. So when they have different voices, sometimes we'll have group therapy. We'll talk among the voices. We'll find out do the voices want to join or not. Find out the role. Find out what their purpose is. Help define. And here's an example. A 12-year-old girl had a ghost come to tell her, or a ghost came to her every night telling her to kill herself.
Wow.
And twice she actually tried to do that. She had been in a psychiatric hospital a couple times, and she was sent to me for anxiety. It was sort of strange as a pulmonologist, but I was doing hypnosis, sure. I talked to the subconscious. Subconscious explained that this ghost was coming, and then I asked the girl, would it be okay for me to talk to the ghost? Because I do not shy away from voices. I think they're a rich source of material. So to say it's crazy or to try to suppress it with antipsychotics, which is what the girl was on, doesn't really solve the underlying issue. And the girl first said, well, she can't bring the ghost. And I said, yes, you can. And the ghost came. I couldn't see the ghost. And I asked her, the ghost, through the girl, is it true you want the girl to kill herself? And the ghost said, yes. I said, how come? The ghost says, she's had a horrible childhood and I want her to be able to relive it. I can kind of understand the ghost logic there. I said, well, I'm helping her cope with her horrible childhood. And when she dies of old age, when she dies of old age, she can relive her childhood should she choose to. And the ghost said, okay, that works for me. And she said, I'd like to become her guardian angel. I turned to the girl and said, would it be okay if she became your guardian angel? The girl said, yes, as long as I don't have to see her anymore. She spooks me. I said to the ghost, is that okay with you? She said, yes. I said to the girl, say goodbye to the ghost. And that was the end of the ghost. Never seen again. We took her off all her antipsychotics. Half a year later, she was discharged on Prozac only.
Wow.
So that's an example of therapy in a potentially traumatic experience. One other therapy I think that's quite useful is to revisit the trauma in a safe way. By safe way, I mean either maybe just the subconscious goes to it so the conscious is not aware of it, or imagining it on a movie screen, or imagining it in a crystal ball, but just some separation. Because you don't want to re-traumatize the patient.
Right.
And then having the patient teach the younger self, the traumatized self, how to do self-hypnosis, how to calm themselves.
Wow.
And then have them relive the trauma in their imagination as if at that time they knew how to calm themselves. And when they complete that exercise, they'll say, oh, that felt different. And if they've had repeated traumatic experiences related to the initial event, I'll maybe have them check out another memory and see how it works now. And oftentimes this is very healing. They recover very quickly. There's some studies that suggest that using propranolol, which is a beta blocker, and keeps your heart rate down, when you're exposed to a traumatic event, prevents you from developing PTSD. And I like to imagine that when we do hypnosis and relive the event and teach the child to remain calm in the memory, that it helps resolve the PTSD.
Yeah.
Hasn't been studied. I've been doing this, but I know studies
Right.
I'm aware of that have shown this to.
But you're seeing it work. Yeah.
It works.
Yeah. How amazing. I mean, I'm excited to read your book. I mean, there's just sounds like so many amazing stories of success and healing that you've been able to find through this. I'm curious, how do you use hypnosis yourself? Like, how do you use this in your own personal life?
Great question. So I use it for sleep, to fall asleep. I use it at the dentist's office to become more comfortable and even to slow my bleeding from gum work. I use it in my clinical practice. I sometimes, I'll slip into hypnosis pretty easily. So I'm working with a patient and I'll come up with questions that I know are from my subconscious because later when I reviewed it, I said, how did I even think of that? Because it just flows. And sometimes I'll actually go into a light trance to ask myself, what should I do next with a client? And so I've learned to trust my subconscious. So I can offer to a patient not just my knowledge and background, but really my inner resources as well.
Yeah, which just makes you all the more of an authentic human being, right? When you're not just telling your clients to do this, but that you're practicing this yourself and seeing success from that as well.
Right, and that helps them buy into it if you're using it.
Right, exactly.
I used hypnosis 12 years ago to help me lose 70 pounds.
Oh, wow.
Weight reduction, yeah.
Yeah. Well, you heard it here first, folks. Struggling with weight, go get some hypnosis.
You can. That's actually often used for weight loss. Yeah.
Wow. So, again, just so many applications. It's amazing. Well, cool. Well, I want to respect your time. I know we went a little bit over, but one way I like to end this is just any kind of general words of wisdom for my audience. What would you pass on to us?
The general word of wisdom is that inside you have resources to tackle any obstacle that you might face in life. Know that. If you're having trouble finding them on your own, seek some help. And recognize that you have abilities that are yet to be uncovered, and you can spend a lifetime uncovering them, but go for it. It makes life so much more fulfilling and exciting.
Yeah. Well said. Thank you, Dr. Anbar. I really appreciate your time.
You're very welcome.